try to take care of yourself. And hopefully this will kind of, you know, I'm always kind of like, well, like let's pregame this so it doesn't get to that level, and as much as possible. I think kind of for everybody, community is everything, right? Utilizing your social support, and we know this kind of over and over again through research. You know, so being around this, so utilizing, you know, your friends, your family, and I think talking about it's key, and that way you know. It kind of normalizes what you're feeling. You are able to it makes you verbalize and articulate what you're feeling. And I mean, we're also social animals. So, you know, being in that together, there's generally a feeling of safety. And that's more of on an individual level. On a community level, so the candlelight visuals, the memorials, the just kind of coming together as a community and saying, this is a tragedy. You know, we don't accept this. We're going to make people feel safe, can really help you not go into that hypervigilant stage for a lot of folks. So that can be really useful. And for some folks, you know, they just do that and really, you know, kind of that they're overall fine, for lack of a better word. Beyond that, and you do have to kind of maintain like a balance. So like I said, I think you can do this. You should do this anyway, but especially if you're starting to feel that you're hypervigilant or you're extra anxious, is kind of I like to use the word balance, right?
Yeah.
So, you know, if you have a tendency of just kind of focusing on this like all the time, thinking about it all the time, telling yourself those negative, scary thoughts, balance that with some of maybe the more positive talks that we did. If you're really just like grieving really hard, you know, spending a lot of time by yourself, you know, repeating the images on television, like balance that with, you know, walking your dog, you know, going on your run. But I do think that there are folks where the hypervigilance really becomes a problem. So I actually read something kind of interesting today about this. If you think back to your, you know, high school psychology class or your first college psychology class, there's always that stage of grieving. And the way that I always remembered it was denial, anger, bargaining, acceptance, right?
Right.
So there's this theory kind of towards mass shootings and trauma where there's like an acute phase, there's an intermediate phase, and there's a long-term phase.
Yeah.
So in the acute phase is really where people kind of have that shock and awe. And you know, it's different for everybody, but they'll say kind of, you know, maybe a couple weeks or something like that, maybe up to a month. And that's really where people are like, how could this happen? Let's make sense of this. Am I safe? And that's really when it is good to do, you know, that social support, that processing. And then there's kind of the intermediate phase, you know, it maybe happens after a month and you're like, okay, like I got to do some self-care. I got to keep on my normal structure. I need to take care of myself. And then there's kind of the long-term phase. And so sort of obviously the good thing about the intermediate and the acute phase is that they're intermediate and acute. So the time frame, you know, goes away, which is nice to know. Even though, you know, of course, you can have some horrible feelings. But there are people who kind of have a long-term thing where they have the long-term hypervigilance. You know, this can be months, and you can sort of see that a lot of other people have kind of moved along. You have the, you know, intrusive thoughts, feelings of re-experiencing the trauma, maybe things that we more associate with like PTSD.
Yeah.
And once you get to that phase, I think it's really important to do kind of, you know, see a mental health therapist, do a group therapy. And that's really where I think the hypervigilance, okay, this is something we need to take to the next level as far as support and help goes.
Are people really good about self-recognizing that they're overextending the acute phase?
You know, that's really hard to say. I feel like that's pretty individual. You know, I would encourage people to be self-aware. I guess I have the experiences both ways. There's some people who are really in tune with themselves and you know, catch it right away. But I feel like there's also a lot of people, especially who have that kind of that old fashioned, you know, move forward, you know, put your best foot forward. So they're really like, I'm having this intrusive thoughts, like I'm going to put this away. It'll go away. I'm going to keep focused. And I feel like those are the people who have a tendency to kind of let it creep up on them to where they're the point where this is sort of out of control. And kind of when it says it's out of control, you know, that's different for everybody. But I think there are some things that we can say are probably markers for most people. Not being able to sleep because you're having nightmares, when you go out, you're feeling not safe, having to sit in the back of the room. So, there aren't people, behind you, avoiding things that remind you of the event, not eating, forgetting things, just kind of difficulty focusing, just sort of your mind's kind of going everywhere. One thing that I also want to throw in here too is, these phases are different for everybody, and everyone deals with it different. But I think one thing that does affect it is your relationship with the event. So a lot of the people that have more of the long-term and more of the intrusive thoughts are maybe people that saw it firsthand, maybe people who were involved, maybe people who lost a loved one. Yeah. Maybe more people who just kind of go through the acute phase are maybe people who are exposed to the images on TV, exposed to it more through kind of an intellectual thing. So I think it also kind of depends on how you actually, it can depend on how actually you experienced it, physically. But also, that being said, I know there's people who see the images on TV and it really has a lasting effect. And I also know, heard of people who have had pretty horrific things happen to them that have dealt with it relatively well.
Yeah, so it's just very, very individual. One of the
animalistic, right? So when we're in that fight or flight, our prefrontal cortex gets like short circuited and our reptilian brain really lights up. And that's where we have that you need to run, you need to protect yourself. So when you're in that state, it's hard to remember to, take your lunch to work, it's harder to follow conversations. So that's another thing that a common effect, and maybe something to look out for. I feel people that are constantly in that fight or flight, I feel like as humans, we're not designed for that, all the cortisol and stuff,
Yeah.
So it's something, I just think it's bad for you, I think it'll get you old quick. So it's something, that, and of course, completely unpleasant. So it's from a neurobiological point of view, it's more healthy to try to get out of that as soon as possible.
Yeah, well, and the data supports it that, this long-term duration of being in the fight or flight response, or, just that kind of hypervigilant state actually contributes to diabetes and coronary disease and all these other comorbidities that we've talked about a lot on other episodes, that if you're not addressing that long-term anxiety and depression, your incidence of these chronic disease processes is much higher.
And for more of a short term, and I suppose this could lead in to long term kind of way to try to manage that. And again, these are just sort of, I feel like these aren't cures, but these are, things that can help.
Yeah.
So I feel like with that sort of fight or flight response, there's kind of two ways to go to kind of short circuit that system. So I like to think of it, and I know this is like a false dichotomy. I love using that word. I feel it makes me smart. So, there's the mind part of it, right?
Yep.
And then there's more like the body part of it. So when you are having those thoughts like, oh my gosh, like this is so unsafe. I could die today, to kind of counter those thoughts. And hopefully, that'll affect, the way your body feels. And those, the other system is to just get into your body. And this is actually what I found has worked better for folks who are really feeling that hypervigilance. And so the way that is you really just want to try to convince your body it's relaxed. So, it's hard to be anxious when you're relaxed, right? It's hard to be in that fight or flight when you're relaxed. And so the way that I found that works best with my patients is just pretend you're relaxed. So for me, what that looks like is breathing slower, talking, more slower, having the voice in your head kind of be more relaxed and calm, breathe in your regular way, kind of go through your body and make sure you're not clenching anything up, not clenching your jaw. And hopefully, like it says, it's hard to have anxious thoughts when your body's, telling your brain that you're safe. If you want to kind of take this to the next level, really what this can look like is a meditation or a mindfulness practice. And that's a whole nother way to go. And there's a lot of stuff online. There's a lot of great links to some free practices I could send you. But sometimes that's a way to kind of teach your body to relax, and can have long-term effects, but also just in the short term can give you a little bit of a break.
Well, that's a great idea. And, again, like this ties in with that concept you brought up earlier, the concept of balance. I think this is a great idea for that every time or anytime you notice that you're feeling that tension and maybe a little bit of an increase in heart rate or that anxiety creep up, to just say, okay, I am relaxed. Mindfulness is a component that I really need to be better about and add in when I feel those own feelings in myself.
Well, so kind of bringing exercise into the picture, and this is probably one of my favorite studies I've ever read. It's like the one thing that really stands out to me in grad school. We say that the exercise worked as well as the antidepressant. So I always feel like if someone comes to me with a mental health issue, I'm like, exercise, and they're like, okay, no, let's talk about my issues. But no, like seriously, exercise. It's so good.
Well, there's tons of data to support that. Actually, a slew of studies that show that serotonin production is increased by 30 minutes of cardio, 15 minutes of cardio. And so, yeah, there's data to support that. I'm concerned personally by a certain cultural shift that we've had where, with our phones, with TV, with the internet, it seems like it's almost impossible to escape this event or these events because they just keep getting replayed. Yeah. Is that an issue? And what should we do about it?
Yeah, absolutely. That's a great point. And it's kind of interesting. I feel like I'm kind of from a generation that's seen kind of technology, evolve. So I think that absolutely plays a role in how this affects people. We got the 24/7 news channels. We got all the people who have taken, live videos of this on their phone. There's, the ongoing, Facebook commentary. There's, the Twitter feeds. So yeah, you're exposed to it, constantly. There's people who are analyzing it, and there's so much that goes, with it. So on a basic level, it can kind of be re-traumatizing to hear that over and over and over and over again. And it can also throw off your life balance. I know there's other people too, that can really, and I guess I'm talking about myself personally to some degree, is, during the, some of the struggle for racial justice, I was really pulled into that. I really, I bet I looked at my phone every hour, and some of it kind of made me question my belief systems. And you could watch some pretty explicit videos of violence. And it really got me to the point where I was just like, this isn't healthy. I personally believe you should be an informed citizen and keep up on the news. That's me personally. But I felt at that point, I was just hurting my body of kind of some of those things that we talked about. So I think it's really important to try to find out what level of news exposure is good for you.